Hello my dear viewers, welcome to AI Medical School. In this video, we are going to discuss about a very important drug which is Omeprazole. But before they start the video, if you are new to my channel, please subscribe to it and hit the thumbs up. Omeprazole is an oral anti-ulcer agent. Omeprazole is characterized as a gastric ulcer pump inhibitor because it blocks the final step of gastric ulcer production. It has a very long duration of action and is very potent, allowing for once daily administration. Despite its potency, it must be used in combination with antibiotics to be effective against Helicobacter pylori. Due to concern regarding long-term use, it was generally approved by the FDA in September 1989 for acute treatment only. In December 1994, an FDA advisor committee recommended it to be approved for the maintenance therapy of healed erosive esophagitis. In April 1996, it was approved for the treatment of H. pylori associated with duodenal ulcer. Belongs to a new class of anti-secretory agent. Now come to its indications. Omeprazole is primarily indicated in the condition like acid reflux disease, gastric ulcer and duodenal ulceration. Gastric ulcer associated with H. pylori. Gastric ulcer reduction during anesthesia, esophageal reflux disease, maintenance of recurrent duodenal ulcer, associated gastric and duodenal ulcer, prevention of relapse in duodenal ulcer, severe or recurrent duodenal and gastric ulceration, and can be given in the adjunctive therapy as an alternative drug of choice in acid aspiration syndrome prevention and GI bleeding. Now come to its side effects. The severe or irreversible adverse effects of Omeprazole, which give rise to further complication in interstitial nephritis. Omeprazole produces rotationally life-threatening effects, which include anaphylaxis, which are responsible for discontinuation of Omeprazole therapy. The signs and symptoms that are produced after the acute dosage of Omeprazole, including tachycardia, drowsiness, headache. The symptomatic adverse reaction produced by Omeprazole are more or less tolerable, and if they become severe, they can treat it symptomatically. These include dizziness, headache, fatigue, nausea, diarrhea, constipation, insomnia, abdominal pain, dry mouth, urticaria, skin rash, potency, depression, dizziness, and agitation. And the warnings are: Omeprazole should be used with the caution in the patient with liver or kidney disease. It should be used only when clearly needed during pregnancy. Avoid using during lactation. In elderly, this is no problem in clinical use to data. And its high risk groups are: drugs should not be given to pregnant mother. If prescribing authority justified the benefits of the drug against the possible damages, he or she should reevaluate them and consult the reference material and previous studies. Now its dosage. The adult dose 20 to 40 mg, frequency 24 hourly, route is oral. Now come to its brands. Risek Rulling. I hope you guys liked the video. If you found this video helpful, please subscribe to the channel and hit the thumbs up. See you guys in my next video. Till then, bye bye.